All right, welcome. So, my name is Dr. Ray Sang, and I'm a cardiologist. So, I'm using this opportunity to just discuss something that I see on a daily basis, on a routine basis, and that's chest pain. And unfortunately, a lot of people will tell me, "Oh, it was just this and that. It wasn't nothing serious," so they didn't get seen. And unfortunately, by the time they get seen or by the time the symptoms get worse, it's sometimes too late. They've developed a hole in their heart because that muscle became so weak from a heart attack that any any attempts to revascularize it or to try to open up that blockage, the damage has already been done. So ideally, you want to be seen as soon as possible if you are having a heart attack. Unfortunately, not everybody presents the same. The classical symptoms of chest pain due to a heart attack is chest pain here, radiates to the left arm, shoulder, sometimes to the jaw, pain that is worse with exertion, such as running, going up a flight of stairs, walking down the block, chest pain that is worse with stress. So if something makes you angry, argument with family members, you get stressed, you have chest pain, and pain that gets better with rest or medication called nitroglycerin. So an ideal scenario that typically happens is, especially now that the weather is a lot better, someone will come to me and say, "Oh, I've been feeling unwell. Every time I go and mow the lawn, I push mower, I start having pain after 30 minutes to an hour. I have to wait 10 to 15 minutes and then go mow it again." So that fits all the classical symptoms. They're having pain here, pain that gets worse with exertion, and pain that gets better with rest or medication called nitroglycerin. If you have those symptoms, go to the hospital, go see your primary care, call somebody. Don't go to sleep. I've had, unfortunately, a lot of people who have had those symptoms and then they went to sleep. They woke up, their pain was gone, but because more or less that muscle tissue has died and sensation is gone, they start having episodes or issues with shortness of breath, and then finally get seen in the so if you're having those symptoms, please go and get seen in the hospital as soon as possible because you could be having a heart attack. Does it mean automatically if you have all of those symptoms that you are having a heart attack? Potentially not. A lot of people can present differently. They can have shoulder pain, they can have back pain, they can have shortness of breath as initial symptoms, they can have nausea and vomiting. So not everybody's going to fit in that box. So if you're having any symptoms that is new, especially if you're having new cardiac symptoms, new just not as active as you were and you previously were a few weeks ago, please go and get checked in the hospital or by your primary care to make sure that you're not having a heart attack. I just see it happen so many times. Ignoring symptoms. I just saw one today and symptoms were very vague, but they were new, they were concerning, and they tried to brush it off. They thought it was reflux, they thought it was anxiety, but it's just not getting any better. So if you're having any of those, it's imperative to just go and get checked because you could be having a heart attack. And there's so many things that can happen if you wait. You can have a VSD, you can have a ventricular rupture, you can have a leaky valve that doesn't get any better if it's been the damage has happened for such a long time. So if you are having any new pain here, pain that gets worse with exertion, pain that gets better with rest, go and get seen. When you're in the hospital, what are we going to do? So we're going to do a set of different things. Number one, we're going to check labs, specifically an enzyme called troponin, released by the heart when it's under stress, such as a heart attack. Have to check it appropriately. Far too often, people are checking troponin levels for the wrong reasons. For example, if you come in and you're having a fluid infection or pneumonia or anything like that, and you check it, it's going to be elevated. If you have a gunshot wound, if you have a traumatic event that happens, it's going to be elevated. So you want to check it appropriately because if you check it for the wrong reasons, we can potentially not know what the true etiology of this elevation is. We'll get other testings, an echocardiogram or an ultrasound of your heart. It's going to be one of the things that we do to look at how well the heart is squeezing. but also how well the heart's relaxing. You can imagine that if there's a section of the heart that's not getting enough blood flow, that area is not squeezing appropriately. If that area is not squeezing appropriately, it could be due to the blood supply in that area. So further investigation with a cardiac catheterization would be warranted to make sure that the reason the heart is not squeezing appropriately is not due to heart failure from a heart attack or from blockage. So what about the other people? Because not everybody's going to fit into those typical symptoms. They're going to have atypical symptoms. So shoulder pain, sometimes nausea, sometimes abdominal pain. Someone once thought they were having the flu when they were actually having a heart attack. So what do you do for those individuals? You keep working them up. You keep doing appropriate testings. You can do a stress test for further evaluation. You can do an echocardiogram or an ultrasound of the heart, and if that's abnormal, proceed with a cardiac catheterization. You can once again do a stress test, and if that's abnormal, you can proceed with a cardiac catheterization. You can do a coronary CT scan, which is almost like doing a heart catheterization, meaning that you're going to use dye to look at the blood flow in the arteries. The benefit is that it's not invasive. So with a cardiac catheterization, you're going through the skin, puncturing an artery, always risk of bleeding, infection, kidney issues with strokes. Those risks are lowered when you're doing a cardiac CT scan. The issue with that also is that if you have blockage seen on a cardiac CT scan, then the next plan is going to be getting a cardiac catheterization. So you may have to expose yourself to twice as much contrast to get the results that you deserve. So there's benefits and risks for it. There are people who are going to be more appropriate for cardiac CT. There are going to be people more appropriate for cardiac catheterization. So you just have to utilize the information, the resources. We have to utilize the information, the resources that we have, and test it appropriately. For my younger individuals, I'm probably going to lean towards a cardiac CT. For my older individuals with multiple risk factors, we are going to reach for a cardiac catheterization to look for a potential blockage. So, who are these people who are at risk of having these atypical presentations, these atypical symptoms? We have women, diabetics, and people with kidney disease. So it's important for us to notice, important for medical providers to notice, because we have to have a heightened sense of awareness that if we have someone who is presenting with unclear symptoms, that we don't rule out immediately cardiac cause, that we actually do appropriate testings to make sure that we're not missing a potential cardiac etiology of their discomfort. We're doing a stress test for them. We're doing a coronary CT if indicated. We're doing EKGs and blood work just to make sure that we are treating them appropriately, that we are making sure that they're not being missed. Far too often we're missing these atypical presentations. So now that we have this information available, we just have a heightened sense of awareness. So kind of just leave this floor for about 20 seconds to a minute for any questions anybody may have, just to be able to. All right, no questions, which is okay. Just using this opportunity to be able to discuss this important findings, this important etiology, this important thing, chest pain, cardiac issues, cardiac heart attacks. When should you be concerned? So this is just going to be a summary. If you're having pain here, if you're having pain that gets worse with exertion, if you have pain that gets worse with rest or medication called nitroglycerin, better with rest or medication called nitroglycerin, go and see your primary medical provider, go and see a doctor, go and see an urgent care, go to the ER, get seen. Don't wait too long, because you could potentially be having a heart attack, and anything that you do now quickly can only increase the chances of restoring blood flow back to the heart as much as possible. If you wait too long, you can lead to a lot of issues, a lot of complications due to the heart attack. You can have issues with the heart valve. You can have the heart not squeezing appropriately for a long period of time. You can have ventricular rupture, aka a hole being formed in the heart due to that muscle tissue being so weak. So heightened sense of awareness. If you're having any of the symptoms, go get seen. My name is Dr. Isang, and if you got any benefit in this, leave a comment, and I'll appreciate a subscription. Thank you.